אוקיי, שלום לכולם, אני חושב שכדאי שנתחיל, מיכל.
אוקיי. אחר הצהריים טובים לכולם, אנחנו מאוד שמחים להיות איתכם אחר הצהריים היום. יש פה קבוצה נפלאה של אנשים מכל תחומי העיסוק של חוויית מטופל, ואנחנו מתרגשים להציג לפניכם באמת חדשנות ומגמות ויזמויות חדשות בעולם הזה, שהוא כל כך קרוב לליבנו בימים המאתגרים האלה, ולשם שינוי, המשבר הזה הוא לא רק שלנו, אלא של כל העולם, ואנחנו חברנו כאן לצוות הגלובלי של BDO העולמית, שבעצם יש לו מרכז מצוינות וחדשנות בעולם הבריאות, וננסה להעביר לכם ולחשוף לפניכם כמה מהחדשנויות והמגמות שיכולות לסייע לנו להסתכל על העתיד בראייה קצת חדשנית ואופטימית. אז אני מאחלת לכולן וובינר מהנה ומעשיר, ואנחנו נתקדם. דב?
I apologize, it was slow.
Okay. And I'm saying good afternoon to our partners from the States, Deb and Chris, and they're going to present themselves later, and I wish good luck to all of us. שמי מיכל גאון אביחי, אני הצטרפתי ל-BDO Customer Management, לעולמות של חוויית הלקוח בעולם המלונאות, התיירות, הבריאות, וכל מה שיש בו care, כי אני באה מהעולם הזה, ומאמינה שחוויית לקוח אנושית מביאה צמיחה עסקית, והחיבור הזה בין החוויה לביזנס, הוא זה שמצמיח את ההצלחה של ארגונים לאורך זמן. ואני משלבת תחומים, של עיצוב ושל אומנות ושל חוויה ושל שירות ושל ביזנס, וגיא, דוקטור גיא יוגב, שנמצא כאן יחד איתי, הוא זה שאחראי לשכנוע של להצטרף לצוות, בעל שנים של ניסיון בעולם של מרכזיות לקוח, ואופטימיזציה של המשאבים של הארגון כדי להביא ערך בעולם הזה שאנחנו עוסקים בו. ואנחנו בעצם פועלים יחד בהרבה מאוד עשיות ואתגרים שנמצאים היום על שולחננו. ואני רוצה גם להציג את נטלי בצוות שלנו. נטלי יועצת בחירה, שבאה מעולם הרפואי, מעולם התיירות רפואית, מעולם הרפואי ומעולם השיווק, וזה האייטים שלנו, של ישראל, שחבר לאייטים הגלובלי שלנו, על מנת להציג בפניכם את הוובינר הקרוב. זה הוובינר ראשון, אנחנו נמשיך ונפתח את עולם חוויית המטופל והמטפל, כי אני מאמינה שהאינטרנל קשור מאוד לאקסטרנל, וככה כל חיי המקצועיים עשיתי, ואתם מוזמנים להעלות רעיונות, לשתף אותנו במחשבות, ובאמת אנחנו מנסים ליצור כאן איזשהו במה של שיח בעולם הזה. אז מי אנחנו? זה הזרוע שלנו, זרוע הייעוץ של BDO Customer Management, שבעצם באמצעות מרכזיות הלקוח מביאה הצלחה עסקית, ואנחנו נוגעים בכל התחומים, אתם רואים כאן את מגוון הלקוחות שלנו מכל התחומים, שהנושא הזה של חוויית לקוח, הוא לב הליבה של העשייה שלנו, תוך בעצם כל הזמן הבאה של חדשנות. אנחנו משלבים תחומים, אנחנו סקרנים לעולם, אנחנו רוצים לראות מה נמצא היום בפוקוס ומה יכול להביא להצלחה והתרגשות. אפרופו התרגשות, לפני המפגש שהכנו הנה דב אפילו מחייכת, דב you're smiling, חשבנו על איזשהו משפט השראה שאנחנו מאמינים בו, שהוא טוב לכל התחומים, הוא טוב לחוויית המטופל, הוא טוב לחוויית המטפלים, הוא טוב לחוויית האורחים, הוא טוב לאנשים שאנחנו רוצים בעצם לגרום להם להרגיש טוב, להרגיש מטופלים, להרגיש אמפתיה, להרגיש אותנטיות, ולהרגיש שבאמצעות הדרך שלנו אנחנו רואים אותם, ואנחנו רוצים לשפר את חוויית הלקוח שלהם, וכל זאת, באמצעות שילוב של משאבים. כששאלתי את דב מה היוניקנס שלהם, ובכלל כל הראייה של מרכז החדשנות והמצוינות במערכות רפואה בארצות הברית, דיברה על זה שזה מרכז שיש בו שילוב תחומים. יש בו שילוב של ה-clinical side, יש לו שילוב של ה-operational side, יש לו שילוב של ה-business side, ויש לו שילוב של ה-customer experience, של ה-emotional side. ואנחנו מאוד מאמינים שהשילוב הנכון בין כל התחומים האלה, הוא מביא את ה-uniqueness, והוא מביא ערך לארגונים, למטופלים, לאורחים, ולכל קהלי היעד שאנחנו מלווים אותם. זה משפט שמלווה אותי כל חיי, המקצועיים והאישיים. יש כאן בקהל גם אנשים שמכירים אותי אישית, ואני כל פעם מתחילה במשפט הזה, שאני מאמינה שהוא גם משפט שמלווה חלק מהעשייה שלכם. So now I want to present our host and our partners from BDO USA, and I'm handing it to you, Deb. Good luck and enjoy our audience in Israel, and hope to see you here in person soon.
Thank you, Mela. Thank you. And it's my pleasure to be here with you, joined by my colleague, Chris Cooper. Hello all, good afternoon. My name is Deb Sheehan, and I've had the pleasure of working in healthcare for about 3 decades. And what's been fascinating to me over that time is whether we're looking at clinical operations, whether we're looking at strategic expansion, whether we're looking at financial resiliency. At the center of all of that is the experience, and as Mahal said, the memories that are created for what we're defining as kind of the new health consumer. In those 3 decades, I will be honest that the greatest challenges that globally we have faced has usually been the prompt or the instigator of transformation and innovation within the healthcare industry. And I think as we all sit here today, obviously with a resurgence in the pandemic in many of the countries, I'm acutely aware of the fact that this is an opportunity of transformation once again. And I think more than ever, it's a timely conversation for us to be having with regard to our focus on patient experience and really understanding what health consumers are seeking from all of you as providers. So really looking forward to sharing. Chris and I have put a lot of material together for you today and are just thrilled to be able to share that with you. So with that, I'll allow Chris to introduce himself as well.
Thanks, Deb. Hello, everyone, and I'm delighted to be joining you. Similar to Deb, I've spent about 20 years in healthcare. I have a background in both process engineering and working as a nurse, and about half of my career as a nurse. And I worked with children with cancer during my career. And while incredibly rewarding, it's always been very interesting to me working with children and within healthcare, we've always worked really hard to make sure that we can make the best out of bad circumstances for children, and we can really make sure that they have the best experience that's reasonably possible. But more often than not, we have not extended that courtesy to adults. And I think that's interesting. In recent years, we started to kind of circle back to that and go, adults are worthy of good experiences. They are often the ones that are making good choices, and oftentimes, in the absence of really understanding things like clinical outcomes, they're going to go where they feel like they were best treated. And so Deb and I spent a lot of time, when I started looking at the kind of roles that people are offered or the processes that they experience, the technologies or their environments of care, thinking, well, what can we do to raise the standard so that not only can people expect very positive clinical outcomes, but that they feel like they're being enveloped in a team of people that really want them to get kind of the most positive outcome, both emotionally as well as physically out of their journey.
And while Chris and I realized that you may know Mahal and Natalie and Guy and Gideon very well there locally, wanted to share with you a little bit of the background that Chris and I bring from a unique center that was formed within BDO about 6 years ago. And it's the Center for Healthcare Excellence and Innovation. And what attracted both Chris and I to the center was really its focus across clinical, financial, operational, data analytics, and legal disciplines. And it unifies all of that together to really address some of the greatest challenges that are confronting healthcare organizations. And so it's that, if you will, 360 perspective that's very unique. And what we're going to focus on a bit today that you see here called out is, as we talk about patient experience, Chris and I thought it might be helpful to talk about it from the lens of some of the more obvious areas of where that influence can occur. We're going to share some of the illustrations and some of the case studies from both women's health, pediatric experience, and cancer care. Specifically on women's health, we're going to take a look at one of the best-in-class examples at the University of California in San Diego. They took a 4-year journey to do a complete transformation of their care delivery model, and as a result have really yielded a substantial investment in patient care, and we'll talk about some of those outcomes at the end of the conversation. We also, in pediatrics, wanted to focus on a profile of Cedars-Sinai Medical Center. Some of you may be familiar with them. They're in Los Angeles, California. And in 2015, they really embarked on a pretty radical transformation of their care experience for their patient population that really did some amazing things with innovations in technology and empowerment of the child, so that there could be a really personalized care platform.
In relation to cancer care, because again, here you're focusing on a chronic patient who has more time, who's going to spend more time with your organization and can kind of become acclimated to your processes. We're going to focus and tell you a little bit about what we did with M Health, which is a health system in Minneapolis, Minnesota, that really pushed the envelope on what they did to leverage technology to allow that patient to have a lot of choice and self-navigation and really kind of choose the level of how much they wanted human contact versus technology-facilitated contact as they went through their journey.
And Chris is going to start us off with a bit of a profile about what patients seek, but I thought before we did that, maybe to look at the macro perspective of what influences patient care and patient care decisions. And we're going to start to talk about patients really as consumers. And so as we look at that, I wanted to start first with all of us kind of taking an audit and a reflection on what does our organization's brand identity as a role play in the total experience. And I think what's key here is it's important to realize that you have a large body of voluntary health insurance, and it plays a very complementary role covering those benefits that maybe are not included by NHI programs, or it's supplemental. And I think consumers in Israel are really seeking it as a supplemental role because it offers access to private providers, it improves amenities and access to that, and sometimes even expedites a faster care. So when we look at all of the variables that might influence a brand identity, I think it's really important to understand that every day, everything that we do as providers really speaks volumes to our health consumer. And that starts obviously with capturing their existing needs, and Chris is going to take us through some of those profiles, but it also takes a shift in our lens with regard to understanding how do consumers really see us? How do they understand what we define as value, and how do we relate to what they define as value? And I think we can take a lot of cues from consumer science here, because behavioral patterns, as you'll see, really start to show evidence with other successful brands of organizations and how they prevail. And I think what's also a unique opportunity is that the NHI has an ability with pretty robust, transparent reporting on quality measures for us to start to extract and understand what are those values that consumers are going to start seeking, and how do they weight them? How do they put priority to them? And so I want to share with you just some examples, just again to trigger some thoughts about consumer science. And the first one is really talking about, as we look at value from a consumer perspective, the quality of Intel. We all know Intel, right? The tech firm that actually puts a lot of the chips into all these laptops that we're living off of and working from these days. The consistency of Starbucks. I'm here to tell you, I enjoyed one of my cups of coffee in Mumbai at the first Starbucks that opened right there down by the gates. And it was amazing to me how that quality of coffee and the experience that I encountered when I walked into that Starbucks in Mumbai was very consistent to what I had experienced, whether I was in Kuala Lumpur, whether I was in California, whether I was on the East Coast of the United States. the innovation of Tesla. So they want to hear from you about some of the progressiveness that's happening. And again, as I started with this conversation, I think we have an incredible opportunity in front of us to be leapfrogging and progressing how we approach care delivery, particularly under the pandemic situation that we currently exist. The reliability of FedEx, all of us have shipped and shipped extensively and predictably, and know that when FedEx says it's going to be there, if it doesn't get there, there's severe penalties, right? There's payment penalties. I love this one, the workplace of Google. You know, how do you attract? Because when we talk about brand, how do we attract talent to us? So when we want the best doctors and the most committed nursing staff, you know, how do we make an environment within our brand identity as well as our experience script that really is attractive to working talent that we're fighting for? The convenience of Amazon, I think, again, expounding on this in the pandemic. We've seen more and more consumers look to that convenience of remote shopping and being able to get something on demand fairly quickly if you're fortunate to be in the Amazon Prime category. And all this to say that I wish I could tell you that you could select which of your consumers would like which of these attributes. However, they want all of this and they want it at the price of Walmart. They're going to get very selective with regard to their expense contribution to the cost of their care and how they value that. So I think it's a frame of reference that we should keep as a lens as we have this conversation, because there's a lot we can draw from here that really gives us that benefit. Chris is now going to take us through a bit on the patient experience and really talk through some of those profiles with regard to the new patient profile.
Thanks, Deb. So one of the things that we need to recognize is that right now there are we're living at a time where there are 6. So as I was beginning to mention, there are currently 6 generations of healthcare consumers. So when we speak about the patient experience, we have to do it with a lens that one size cannot fit all, and we need to be able to infuse as much choice as possible to allow kind of an adoption by the people as they seek it out. And it goes anything from, of course, the baby boomers and the silents who are still fairly differential to what their providers direct them to do. They're looking for much more of a high touch. They tend to be somewhat resistant to technology, that they're going to want a very different experience than, say, the millennials, the Gen Z, the Gen Alphas and their parents who are very accustomed to technology. They don't necessarily need to see you as long as you can get the job done. Sorry with the background noise. So they really are more about kind of getting it done at their convenience, when they want it, where they want it, which really creates a very different kind of thing. I always make a joke kind of in parallel that if I have to call a restaurant to make a reservation, if I can't do it on my phone, then I'm not going to that restaurant, because that's just one more thing I have to do. Or I jokingly say that for me, my high value during my healthcare experience is the time in front of my provider, and every other step in front of that is just a necessary evil. Now, well, my grandmother enjoys the waiting room and making 6 new friends every time she goes to the physician. So
it's really kind of looking at each of these, and if you follow along with us as we go through the illustrative case study, each of these icons is going to appear during each step in this process. So I think it's really important as we go through this to kind of take stock of the impact of those touch points as we look at this. So the patient's journey, as we all know, starts with the pre-arrival. So this is kind of hearkening back to the brand identity. This is when brand reputation and what they're associating with references to your organization as far as expectations. And as you might imagine, at this phase in the pre-arrival, there's a real mix of emotions that a healthcare consumer may be struggling with. They may be looking at perhaps the anxiety about what's the apprehension. Really what we're looking at here is the dealing with the emotions that healthcare consumers may be experiencing on the pre-arrival. And again, brand reputation speaks volumes here, because in this pre-arrival phase, you're going to see that we're going to talk through quite a bit with regard to how they source and seek care from you. Most importantly is the brand reputation that really brings that level of trust in that connection. It's also going to be a time when they are seeking quite a bit of information online. So your social presence, what you promote, how you align to those values that we talked about earlier in the conversation is really important, because it starts to frame expectations. And it also shows that as we look at the impact of what the pre-arrival stage can do, it really sets the stage for the entire patient journey, and also is, as research has shown, is the critical step with regard to how you will secure brand loyalty. So how a patient not only finds you once, but how they return to seek services, not only for themselves, but their extended family. So that's a powerful point with regard to the pre-arrival. Looking at reputation first and foremost, I talked about social media a bit, but even the iconic nature of your facility. I think we've all kind of come to grips with the fact that as a patient or health consumer, I have no business evaluating clinical efficacy, right? Chris may, my colleague, but I cannot. And as most of lay consumers, I'm going to cue off of visual cues about quality. So as I look at even the exterior or the campus, is it clean? Is it well organized? Does it have a progressive or an iconic shape or configuration that maybe gives me an insight to how progressive that organization may be? What kind of innovation and skill level might exist within that facility? So you can see here UCSD, that one I mentioned early on, was one that we did some branding for women's health services, and they really wanted a progressive and an iconic statue that really was the building form that seated itself on the campus well and attracted patients with curiosity to come in and really understand what they might be offering. Chris is going to talk a little bit more about some of the remote linkages that we have on social media as well.
Yeah, and of course there was a heavy drive for this, as you can imagine, during the COVID-19 crisis. But even before this, there's been a desire for patients, not only related to their clinical care and being able to have remote access to their clinical care, but also that ability to address a number of the administrative functions that are part of healthcare. So whether that's the registration or scheduling or all those kind of things, trying to narrow down the actual time on a healthcare campus to care delivery, and to take everything else out of it and allow them to do things from home. So whether that be follow-up education or anything they can do pre-arrival. And then even in today's world, of course, also saying, can I do if I'm a patient with an established relationship with a known issue, is this something that I can handle exclusively remotely? As Deb progresses to the next slide, the next big piece is just even for the people who are going to come to your campus, what can you do to make the journey from their home to your campus as easy as possible and intuitive as possible? This conversation comes a lot with me with my clients that are in urban and major city environments. There's many a patient that will say that while they like so-and-so downtown, I hate driving down there, I hate dealing with parking, I'm so confused when I get down there, I'd much rather go down the street to my suburban provider. They may not have the same quality, but it's just more comfortable for me to get there. So really thinking about a way that your journey, your patient's impression of you begins well before they arrive on your campus. It has to do with more or less how they first are able to interact with you, whether it be on phone call or computer, as well as their journey to you. And we need to continue to think how we can make that as easy as possible.
The other piece, and this may be obvious, if not intuitive, is just having direct and clear circulation pathways. So whether I'm coming in my private vehicle and I'm arriving and I want to be in a protected environment once I park and I feel secure and safe, and have a direct link and access as I move into the facility. The other option is if I'm arriving by public transit, how am I taken in and received? That leads directly into how do I use some intuitive wayfinding? So clear entry features, well lit, that are easily identifiable. We shouldn't rely on a lot of signage, particularly in today's diverse community. We really want to lessen the need for having to read signs in order to follow wayfinding. and actually want natural cues. And again, that behavioral psychology starts to give us some premise of, you know, how light do we find someplace, and do we see that as a destination? You can see that a lot of transparency, being able to see spaces inside out, being able to understand what's beyond the walls, again, brings a sense of security. And it brings a perspective with regard to always having what I call situational awareness. And when we have situational awareness, we always are cognizant of, okay, this is where I came from, this is where my destination is going, it's clear, I have sight lines, and as I move through a building, I always have an understanding of proximity to where did I park my car, or where was that reception desk, or where were the elevators that I needed to access. So again, I think we've got some great opportunities here just by being thoughtful with how we plan and lay out. If you're renovating or have an existing facility, simple cues with regard to materials, light levels can be modified in order to accomplish this as well. So now we're going to transition a little bit and move into the arrival sequence. And what we're going to talk through here is as much about some of the design thinking that's important to really have these attributes of making someone feel welcome and comfortable, that there is a personalization and something that you knew I was coming. I mean, we all love that, right? When we go and even stay in hotels, when somebody acknowledges you and can greet you by name, you know, that is a transformational. When they knew you were coming and they anticipated you. And unfortunately in healthcare, so often we get to a very transactional level of behavior where I'm offering the same information over and over again. So I think it's important that, you know, these are items on the arrival sequence that we can pay close attention to that make a world of difference with regard to patient experience. We're going to talk a little bit about some of the intake space of just waiting. When I approach a facility, this is an example from Pro Health, and what they wanted to do was really have a sense of alignment to the community. They wanted to be able to have people recognize that this had a sense of place, that this wasn't just dropping into a health facility from anywhere. They recognized that some of the indigenous stone from the quarries locally was going to be recognizable about a sense of place. They also recognized that they wanted to really speak their values, and you see the language gratitude over there. That was really important as well. So it's all of these things, again, I said this earlier, gang, but everything speaks. Everything you do should be a thoughtful and intentional decision. Nothing is happenstance, because your customers, that health consumer, is paying attention, and even inherently, I say this often, you can meet their expectations in surprising ways, because sometimes it's the simplest gesture that makes the world of difference there. And so when we talk about expectations, I have explicit expectations as a consumer that I might communicate to you, but I think the magic with patient experience and successfully elevating it is really having those latent expectations, the ones I didn't even know I had of you, are met, right? So you have surprised me. You have exceeded my expectation, because I wasn't even conscious that it was something that I valued. So that gets back to that consumer segmentation that Chris had spoken to earlier, and really taking the time to understand who is that audience that you're trying to relate to, and how do you do that? So we're going to unpack this a little bit further. I'm going to ask Chris to talk through a bit of the example from M Health that we mentioned earlier that really had a focus in cancer care.
So again, as Deb talked about, I'm going to talk you through about 4 slides specifically about how M Health uses technology to allow autonomy and choice for their providers. And first of all, when the patients arrive, what they do a really good job of is that they plotted out an entire itinerary, so the patient knows, and it's sent to their home, to their smart device, so they know whether or not, you know, if they need to go to the lab first, or if they need to go and get imaging done, or if they're seeing multiple providers. There's a plan for their day. And they do a lot of just-in-time scheduling, so that if some of those areas are running behind in real time, they will reorder that to really do their best to make the most of that patient's effort. And again, be communicating with that patient through an app on their smart device. And so we go to the next slide. The other thing that they do that's still somewhat unique, although gaining traction, is they really leverage real-time location services, or RTLS. And every single person, both patients as well as providers, wear a badge that looks like this, that more or less shows their location within 3 feet anytime they're building it. This allows a lot of coordination of exchanges. It also kind of gives a lot more freedom. Now, to be fair, these badges that you see here cost about $160 a person, and there's a lot of effort for them to make sure they collect these as patients are coming and going. However, since this has started, there's now a disposable paper band that costs 3 cents that does the exact same thing. So we know Memorial Sloan Kettering Cancer Center in New York City has adopted a very similar workflow, but at a fraction of the cost because they've been able to take on this disposable device. So one of the ways that we use this as we go forward is, again, giving those patients an opportunity for choice. So they're no longer restricted to a single waiting room because they are tagged and they know where they are within 3 feet, and they know where they're, because of their update on their itinerary, they know whether or not their providers are running on time. They have an option to go to the cafe that's here, or the learning center that's here, or there are different areas of kind of sitting in waiting areas where they can kind of choose how they want to spend that time up until they're ready for their clinical intervention. And to that point also, because the staff knows where they are at all times, there's no walking into a waiting room or going into overhead device and saying, you know, Mrs. Jones, and having her come forward. The staff is able to walk up, again, within three feet of someone, identify them by name, and give them the choice to escort them back to the exam room. Also, if people are so want to, they can also more or less choose to be self-roomed and just get a notification that they should now proceed to exam room 3 or 4, what have you. So to go to the next slide, the other thing that does a really great job of doing this is really also managing the best and highest use of space. What you're seeing is a dashboard that's available on every one of the computers that allows them to see within their clinic what rooms have patients in them, where the provider is at any given time, and even color coding, which I like a lot. The rooms you see in red are rooms where a patient has been in that exam room without any member of staff going in for at least 10 minutes. So there's also automatic triggers if we've more or less created a situation where we've just moved our waiting room into our exam rooms rather than actually progressing care. So this allows a lot of coordination, it allows a lot of reporting and performance improvement that allows this organization that's done profound improvement in their overall processes because of the great data that they're getting from these systems.
Great, thanks, Chris. Now I'm going to move us forward into patient treatment space. And well, this is the obvious area of everybody's focus. I do think there's some call outs even here to talk about how do we really engage more actively the family participation while at the same time affording privacy. And how do you support caregivers in a much more collaborative environment? So while it's one of the most significant factors affecting a patient's perception of healthcare delivery during their often emotional or stressful time, I think what we're trying to do with patient spaces today are really empower that patient with a sense of control that is customized to their personalized preferences, and that also then enables an effective collaboration with caregivers and that care team. Additional to that, really extending that care team to include the family, so that the family becomes really an integral part of the care delivery team and feels equally empowered. So again, as Chris has said already, in our solutions, we try to advance that the operational efficiency and design excellence don't need to be mutually exclusive. They need to work in partnership. They need to come together. So as we talk through this area, something that I just wanted to call out that I think many health providers have tripped on in the past is how to meaningfully engage family space into the care treatment space. Sometimes at best it's an afterthought and there may be some care kind of stuffed into a space that is grossly inadequate. But often, more often than not, particularly with the climb and acuity, whether that's in the inpatient or whether that's in the space that we want for birthing, as you see in this picture, being thoughtful about how we accommodate family accommodations, whether those be for extended stays, overnight options and availability, particularly in pediatric settings, as Chris has got experience with, becomes very important, while at the same time affording some privacy and intimacy without restricting caregiver sightlines. So that's the other important piece here, is that keeping that active engagement. We talked a little bit about personalized control, and at UCSD, they really took this to an extreme. They allowed that there was going to be on demand to the patient on an iPad kind of device, the option to control their light levels, control aromatherapy in the room, temperature controls in the room, even artwork that comes up on the LCD screen at the foot wall of the room was all on demand and customizable by the patient. We took this the next step forward with Cedars-Sinai in a pediatrics environment where really the entire room became an immersive experience. We worked with gaming developers in Hollywood that really looked at how could I take a child's room and by manipulating the scene setting or the color tone and of the lighting, I can actually have physiological responses that are positive. I can lower blood pressure. I can lower respiration rates. I can ease anxieties. And we've seen this now also used in treatment spaces, right? The immersive Philips technology with regard to how the positive distraction really mitigates the need for IV sedation in a lot of the pediatric patient populations, but also just the body of research, to Chris's point, of the adults really benefiting from the same level of positive distraction and looking at, you know, the health environment research. Multiple journals have published on the use of natural light and access to exterior views, really helping with reduction of pain recognition, helping reduce stress levels. Again, all of those triggers physiologically that often are some of the impediments sometimes of some of the treatment spaces. I'm going to ask Chris to talk a little bit about some of the collaborative team as well from the perspective of the staffing.
Yeah, so a lot of what's happening in healthcare, of course, right now has to do with a lot of coordination of care. So whether or not that is provider to provider, provider to nurse, to social worker, to dietitian. And as important as the collaboration is where it occurs. Because while I'm a huge fan of collaboration, collaboration also creates a lot of noise. And there's a lot of times where the feedback from patients and family members are that this calm environment is disrupted by the noise level, the conversation levels of caretakers. And so thinking about what needs to be close to the care zone and what can be done in other places is a really important thought of both process and space design. And that's kind of a lot of times as we go through things, whether or not it's looking at these kind of workplaces where you can see this is the idea of where a nearby but not in the clinical zone care environment where a provider can step away to make phone calls or do their dictations or do those other kind of things. And it has to be nearby, because if it's somewhere far away, they won't use it. They'll cram into their immediate clinical workspaces because they need to stay close to their patients. But if there's something where you can get a step away through perhaps on another side of a door, it can make all the difference, again, in really kind of protecting the calm and serenity of your direct care environment. So similar to that, now that we've really kind of talked about the care, it's as important as far as our plan to transition our patients back to their homes, whether it's home from a clinic visit or home from a hospital stay. The best patient is the patient where we have addressed their anxiety related to what they're supposed to do next, to make sure they understand what to look for, they understand their resources. So often, we know, at least in the NUS care, the quick return to an emergency or an after-hours clinic is not necessarily for something where there's a clinical need, but more a lack of intelligence around kind of being able to self-assess and understand what they need to do. So, and I think it also really ties the bow around the experience as a whole, because if you're suddenly kind of left not knowing when you're supposed to leave your room or your exam room, or not sure of how to get the way out or what's next, that's a very quick way to change an overall good experience to feeling somewhat abandoned. So with this in mind, as we go to the next slide, so the big piece of that is, of course, to start education early and to have it where, again, it can be on demand. So whether or not it's the person-to-person treating education, which I did a lot personally as a nurse, but also making sure that you're leaving them with information, whether or not it's through something electronic or paper or something that they can review on their own. A lot of times when I talk to patients, a lot of times, particularly during a first-time encounter, they say that no matter what you're saying, all they hear is white noise, and that they're not really absorbing anything. And so making sure that you have a chance to speak with them, give them something to review, and revisit it to make sure that there's some kind of retention is incredibly important as far as an overall strategy for education. Second piece of this is also kind of bringing, and again, talking about multiple generations of patient consumers, is giving them something accessible to where they're at. So whether or not there are technology-driven pieces that might be part of what a younger generation might want to be, it might be either written or even videos or blogs or other kind of things, or audio devices for someone older, making sure that you, again, just as much can kind of customize your discharge planning to multiple generations. And also, I think this is as important as also is making sure that you don't always necessarily do all of this work in the care environment. The care environment is the most expensive environment that you have, and you want to make sure that you're functioning and having that be really focused on care delivery. And when it's appropriate, having other kind of alternative spaces which create a different environment, a different level of stress versus kind of now, okay, this feels more home-like, it must mean I'm closer to being ready to go home. You can take a different kind of environment where you can have conversations, so it's more of a talking space rather than perhaps a treatment space.
Great, thanks, Chris. And so now we're going to kind of shift to the post-discharge. And as I mentioned earlier, this is where we make or break brand identity and loyalty, because it really talks about taking all of the work that you've done on the patient's journey to date, not only in them seeking care, but accessing you, accessing the care, feeling empowered on discharge. And now in the post-discharge, really they have to navigate and continue on this journey without direct support assistance from you as a health organization. So when we talk about this, it's really feeling like you have imparted enough of the education that they have learned, that they feel strengthened and fortified to be able to continue their journey, and really in the merits of focusing on population health, really accessing you and knowing that you're there to rely on in times of need, but really trying to maintain that relationship as a healthcare organization when it's not that heroic intervention, when it's not a time when I have to come to the hospital to access you. So clearly this happens first and foremost with community outreach. How is primary care accessed? How are people feeling like that community is going to be something that supports them closer to home, perhaps? And I think that often when we look at patients that extend their care plans at outpatient facilities, often those facilities provide elements that draw them in and encourage them to be active participants in their health. So some of those key strategies might be a wellness-focused center, right? Providing walking paths on the campus, encouraging the community to come and see you as an extension of health as opposed to that health intervention, right? I think as well, we also see that having open lawns, often used for outdoor yoga classes or farmers markets, are another key strategy to kind of bring the community to you and have them see you as a partner over their lifetime as opposed to an episode of care. We've seen some install public art that inspires kind of multi-generational demographics of visitors to come to a destination of a wellness center. Again, it speaks volumes about what you value and your commitment to those healthcare consumers. Additionally, those wellness centers often include teaching kitchens. More often than not, we're starting to see the community and promotion of healthy food cultures and educational programs that welcome families, promote self-advocacy, and address the social determinants of health. So again, another key feature you can do here. Oftentimes, there are also extensions perhaps of cardiac rehab or sports rehab, bringing in classes of strength training, Pilates, yoga. And again, if you don't have the physical space to do this indoors, often just making it available as a walking path or a meditation labyrinth. Some of those are some of the key strategies that can use landscape to help kind of reinstate this. The last piece is really that mobile connection. We're all slaves to these devices these days. And how do I feel empowered with on-demand access to not only my medical record, but again, coaching. And so again, those touch points in using your platform to be able to, again, take your brand, take your values, and make sure that those are finding your healthcare consumers in their home, that it becomes something that's ever present and that's in front of them so that we can see those networks. Here in our community, we had Rush University Medical Center that it really expanded a very large virtual health program, and they built off of not only their own patient network, but community partners. And they brought in partners in communities that were looking at whether it was like a gym service or whether it was the local grocer and grocery store. They also then saw that as a result of that, and this was their platform, what they call DocTella, they had resulted in a 57% decrease in their readmissions. So to Chris's point earlier, sometimes just empowering with the right information in my hand will forfeit me from having to go back to have another episode of care at the hospital, because I can proactively address it because I now am empowered with this device with information. So thanks, gang. I apologize for all the technical difficulties. We're going to wrap you up here quickly, but I would be remiss if I didn't at least state some of the exciting patient outcomes that we have seen as far as some of the takeaways. And not surprising, when you focus on this, we've seen movement of upwards of 20% plus of percentage points in willingness to recommend scores. So that is a direct result of, yes, patient satisfaction increases as you see here, but not surprising to anybody, you're still really in a competitive environment with those electives that are still seeking care from you. So beyond kind of the base level of care, a lot of the alternative medicines, a lot of the wellness programs, there's heavy competition for in the market right now. So how you increase your market share, how you expand with volume in your patient population has everything to do by the experience that you have created. So kind of back all the way to the beginning where Mahal started us, is they don't forget how they feel, right? And so we have to make sure that we're paying close attention to that. As Chris mentioned, the net gain in operational efficiencies and workflows, seeing increases in patient throughput is critically important when you have a demand and access for care. And hopefully, as we move through this pandemic, we're going to start to see some lessons learned as far as how we have expedited some of the care and how we have extended virtual health to be able to manage populations more effectively, really have a dramatic effect on the operational efficiency. And then clearly the cost-effective care. All of us are fighting this battle daily, with our out-of-pocket expense contributing to this as far as our insurance burden, but also as a consumer, but also as you as healthcare organizations, trying to eliminate that waste and lean up and focus on what's important. Focus on where the high-value opportunity is that meets your consumers' expectations and elevates the quality of care and the experience over the continuum of that patient care journey. So a couple of opportunities that we have immediately in front of us to make a difference. And again, you can start with small steps. This doesn't have to be a big dramatic move, but looking at how do I really assess what I'm doing today and what could I elevate to personalize that care experience. The best way I found to do this is we create focus groups and we talk to our patients. We talk to the patient as a consumer and really start to caucus from their feedback and input, what would have made a more noticeable difference? If you're already doing post-care surveys, pay close attention to the trend lines. See what is consistently an area of focus for improvement. The ease of access. Are we making it easy to access us, not just physically, that's the obvious, right? But also on web platforms. What is my presence on a website? Can they find me, as Chris said, can they schedule easily? Can they look up the qualifications of my physicians? Can they see transparently how I outperform my competition in quality scores and measures? Promote that. I think that's really important. As we look at education and information, we talked about that handheld device, the sweet sauce there as far as empowering your consumer. An educated consumer is your best buyer. You want them to have more information. You want them to be educated about expectations, and they want to see your differentiation. Where do you stand out versus your competition? How are you different? How are you responding differently to the health needs? As we've talked about consumer science throughout all of this, is take your cues from retail services. You know personally what you resonate with as a brand, some of those value sets that we talked about early on. How do you start to instill those in either your processes, perhaps your communication scripts from your staff, I mean, how are you treating that consumer to really resonate with some of those retail attributes that have had strong and sustainable brands over time? And then lastly, I'd be remiss if I didn't say that we cannot exclusively just focus on patients. We must understand that you are in constant competition for caregivers and high quality physicians and nurses, and they are your representation. That front line is your representation of your brand every day. So it doesn't matter what the CEO necessarily thinks is being communicated. What matters is what's being said and communicated and instilled by your staff. So taking care of them is pivotal, and expanding that patient definition to include families is really, again, something very, very critical. So with that, Mahal, I think I'm going to conclude here and turn it over to you for some questions if we still have some time. I think we're past time, unfortunately, with our technical difficulties. But I will thank everybody for your time and attention today and your patience with us as we went through some of these technical restarts again and again. Thank you.
Mahal, you're on mute.
On mute? Yeah. Thank you again, Deb, and thank you, Chris, for really this inspiration, this fantastic presentation. And I really apologize for all those techniques, but this is technology. And if somebody from the audience wants to ask the questions, please do, and we'll have a few minutes for Q&A. But I wanted to ask you a question that, you know, it's necessary to ask on those days on COVID-19. What is your perspective and what are your insights that what we should do more in this period of time, and what are the challenges and maybe tools on the patient experience area?
Sure. Maybe I'll let Chris start, because he mentioned in the strategies with regard to how the intake and waiting process is happening, and then maybe I'll complement that with some of the
Okay, great.
Sure. So I think first, just philosophically, we have to change the way we even, for elective cases, when patients are choosing to come to us, how we schedule them. Because one of the things because our caregivers are one of our most expensive pieces, we want them to always be busy. So we tend to load a lot of patients in at the same time so they can go one to another to keep them as busy as possible. This creates waiting. This creates waiting for the people. This creates environments where they all have to sit in waiting rooms. And I think there's going to be a less tolerance for that. So I think one of the things we have to do is really start to adjust when we have patients arrive so it is better paced for when they can receive care, and get as close as possible to a just-in-time process as we possibly can. The other piece, as far as the waiting experience, is again giving people choices, and there's a lot of that already happening. There's Modern Healthcare recently had an article that more and more are doing an opportunity where, somewhat similar to a restaurant, you can go ahead and give them your cell phone number and return to your car or return outside and choose to wait somewhere other than inside of their waiting room. So I think giving people alternative and space to kind of self-select and create social distances is going to be a big part of what we have to do going forward. Deb, if you'd add on.
Sure, and I'll just toggle on quickly with regard to virtual health platforms. Is I think one lesson we've learned with this pandemic is that, you know, we have to be able to utilize the technology available to all consumers. And as we're looking at whether it's incident rate tracing, whether we're looking at primary care extension networks, mental health groups and networks coming together on virtual health platforms, I think enabling more empowerment with those devices is really going to not only allow us to personalize care, but it really transposes where the care can happen, right? So we're seeing the advent of a lot of the even diagnostic technology that is now able to be done off of these lovely little devices. You know, we've seen ultrasound apps, we've seen diagnostic testing of echocardiograms on these phones. I think we're gonna only see that explode and expand well beyond what we've even done, but I think unfortunately COVID-19 has really been an impetus for a leapfrog in that development. I did want to talk, Chris, just and maybe toggle back to you for a second. As we talk about patient experience, one of the questions that came up was really looking at, you know, how do you make staff experience or value the patient experience? How can we have them appreciate that because they've got so many other priorities as well.
Yeah, I think there's a couple of different ways that we can do this. First, just the psychology in general that generally if you're anyone that's been a nurse or provider has had a cranky, difficult patient, and I've had the patients where you don't even want to walk in the room because you know it's not going to be very pleasant. And often, if you can keep your patients happy, typically your job is more enjoyable. But putting a pin in that as well is I always kind of go to the nature of people's natural competition. So I've worked with many hospitals that what they do is for every department, they publicly across the entire hospital put monthly their satisfaction scores. And so there's a vying to whoever can get to be the most, the department with the highest satisfaction, and typically there's some kind of award system. There's another, there's a hospital in Texas that, oh gosh, almost 20 years ago, more or less tied in a hospital-wide incentive program that should their patient satisfaction scores hit a specific threshold each year. Everyone from those who clean the hospitals to those who do surgery would receive a financial bonus that was purely exclusively based on patient experience. And it really led to just anyone walking down the hall picking up any kind of piece of trash that's there, just everyone doing everything they could to drive their scores. So I think whether or not, I'm a big one for either financial incentives is an easy answer, competitive spirit I think can be really creative, or again, creating this psychology that happy patients typically make your life easier is often the case.
That's
Other
great.
questions or comments?
Yeah, we have one more question and our time is up, but if anybody wanted to ask a question, please do, and we invite you to stay.
Great. I think the next question is an interesting one, and it's a challenge. It's how would you recommend to balance all patient-centric elements institutions are looking into implementing so that different patient segmentations are satisfied? You know, I'm going to use an example that I think is probably very universal. And it was something that we did at Cedars-Sinai, and maybe it's a great illustration because it's pediatrics. But how many times have we gone into either a children's hospital or a pediatrics unit? And unfortunately, I always use the analogy of it's Walt Disney on steroids. It's customized to an age demographic that really doesn't respect the full range of pediatrics. So when you think about pediatrics being age 1 to age 17, how uncomfortable is, you know, Disney characters or Pooh Bears or whatever's on the wall for a 17-year-old teenager, right? So what we found at Cedars-Sinai, that was that one that we did with the immersive experience with the Hollywood studio and the gaming systems, is we found personalizing and letting the child dictate the environment. So it almost treated it like an art gallery with just white walls. And then there was an immersive overlay that was all technology enabled to allow them to really cue what was most comfortable for them. So if I was a teenager and I wanted to have my favorite rock bands, you know, all sprayed up on the wall with posters, I could do that. If I was a 2-year-old and I wanted to have butterflies or bears, or if I was in my princess stage at age 7 and I wanted to have all of the princess icons up on the wall, I could do that. And as we look at kind of taking that to the next level for all populations, I think it's just that courtesy of allowing the patient to bring in what comforts them. Because I can even say with the diversity on our panel here today, what makes me comfortable in an inpatient setting or a testing setting is not the same as what makes Chris comfortable. I can guarantee you of that. And so I want to be able to say, you know what, I prefer the color purple. I prefer to have, you know, floral scenes. Chris may have a whole different set. And so being able to allow technologies, because they are getting so inexpensive to be able to apply now, allowing that to personalize. And even if you can just start small, and maybe there's an LCD screen, instead of investing in a lot of artwork that you're not going to like in 2 years on that wall, you know, put an LCD screen up there and let it be on demand so that I can remote my own artwork to it, and I can look at what I like to see curated, not what you like to see or what you liked 2 years ago as a healthcare administrator. So I think that personalization allows you to get that broad spectrum. It'll cover ethnicities as far as variety. It'll cover demographic variety. And it allows kind of that highest level of comfort because I relate to it at a personal level. And again, that gets back to that statement of what are my memories made of? They're my personal inventory of what I favor, right? So that's the part that I think is really important, that is probably the best strategy I have found to date to be able to get across that large strata, because you're right, it's a pretty heroic ask of healthcare organizations today, and you have to do it at low cost, and you have to meet a variety of expectations. So no small challenges. Any other questions?
Thank you. I don't think any other questions.
Great. Well, Mahal, I really, Kristen, I love.
תודה רבה לכולם שהייתם איתנו. And please, you can say hi to everybody, and we hope to see you again with us. And thank you for all your inspiration and your professional way of showing us. So have a nice afternoon, everybody, and you have a good morning.
Thank you
See you
all.
soon.
Take care. Be well.
ביי, תודה רבה.